Polyaluminum chloride, or PAC, is a highly effective coagulant used to reduce turbidity in water purification. Specifically, the high basicity grade, known as PCH 180, is a critical asset in many modern treatment facilities. Because operators handle it every single day, it is easy to begin treating it like any other benign liquid. But that familiarity is a serious vulnerability. PCH 180 is highly acidic, with a pH dropping well below 2.0. It is silently and aggressively corrosive to unprotected skin and facility metals alike. If mixed improperly or exposed to the wrong materials, the chemical reaction generates extreme thermal spikes and releases dangerous, irritating vapors into the immediate workspace. Failing to account for the specific acidity of this material leads directly to the catastrophic degradation of tanks, piping, and metering equipment. Before approaching a tank or touching a valve, establish a physical barrier against the chemical. Skin protection requires acid-resistant neoprene or rubber gloves, paired with heavy protective clothing like industrial coveralls. Standard safety glasses leave the sides and bottom of your eyes exposed. Because of the severe splash risk, you must wear tight-fitting chemical safety goggles or a full face shield. Before starting work, verify your path to the emergency eye wash and shower stations. You need to be able to reach them completely unobstructed within 10 seconds of an accidental exposure. Compliant gear and accessible safety stations are your final fail-safes against a permanent chemical burn. During a bulk delivery, the facility operator has an active responsibility to physically observe the entire filling process. Before any connections are made, verify the driver ID and the bill of lading. Then check the certificate of analysis to confirm the load is AWWA B408 compliant and matches your exact chemical specifications. Inspect the mechanical setup. The truck must have leak-proof connections and quick-closing emergency valves. When clearing the chemical delivery lines, the blow-off air pressure must never exceed 18 pounds per square inch. If you need to dilute the chemical manually, always add the PAC into the water. If water hits concentrated PAC, the sudden thermal physics cause a violent boiling splash reaction. Rigid oversight during the entire transfer neutralizes the highest risk window for massive chemical exposure. PACH 180 sits at a severe pH level, typically between 1.8 and 4.5. Storing it safely dictates very specific infrastructure requirements. Storage tanks must be constructed from high-density polyethylene, fiberglass-reinforced plastic, or acid-resistant rubber-lined steel. Carbon steel, aluminum, and brass are strictly prohibited. The acid rapidly degrades these metals. Every storage area requires secondary containment bunds. The mathematical rule is absolute. The bund must hold exactly 110% of the largest tank's volume. Beyond this, the piping architecture must completely isolate this coagulant from other treatment assets to prevent cross-contamination. You must never allow PCH 180 to mix with sodium hypochlorite, commonly known as bleach, as well as sulfites or strong bases like ammonia. If these incompatible chemicals meet, the resulting reaction immediately generates extreme heat, throwing corrosive splatter and releasing highly toxic hydrogen chloride gas into the air. Correct material selection and strict chemical isolation form the basic structural architecture that keeps the facility intact. If a spill does occur, your immediate first actions are to secure the perimeter and verify that all responding personnel are wearing full protective gear. For minor leaks, contain the spread by absorbing the chemical with inert materials, such as dry sand. Large, contained spills require a slow, deliberate neutralization process using alkaline substances like lime water. You must continuously monitor the pH levels to confirm neutrality before you proceed with disposal. For skin contact, immediately wash the area with soap and running water for 15 minutes. For eye exposure, proceed directly to the eye wash station. Flush the eyes for 15 minutes while manually lifting both the upper and lower eyelids to clear any trapped liquid. Whether dealing with a skin burn, a severe eye exposure, or toxic vapor inhalation, the mandatory final step is always to secure immediate professional medical attention. A heavily practiced emergency response plan ensures localized spills are contained before becoming systemic tragedies. Managing PCH 180 relies on 4 structural pillars: verifying your PPE, maintaining strict transfer oversight, using compatible infrastructure, and keeping your emergency readiness sharp. These overlapping protocols create a resilient operating environment. They protect the personnel on the floor and by extension, they secure the broader community water supply. To keep your facility running safely and stay up to date on compliance protocols, make sure to subscribe to the channel. Please note, this training does not supersede local facility regulations, nor does it replace the official safety data sheet, which should always be consulted directly. Long-term facility safety depends on maintaining a disciplined awareness of the chemical's destructive potential, ensuring that routine never becomes an excuse for a lack of caution.